Wache, and welcome. This is Anne from the Sioux Lookout Practice Consultant Team, and you're listening to the Practice.Support podcast, the one and only show that discusses new practice updates and changes for ISC's Ontario region. Coming to you with acknowledgement to the Anishinaabe Algonquin Nation, whose traditional and unceded territory this podcast is recorded on, and with respect to the different traditional Indigenous territories of Turtle Island that this podcast may find you. Hello everyone. Today I have Kathy Ramonal. Kathy's a nurse practitioner with over 15 years experience in primary health care, and she's a member of the education team as a nurse practice consultant. Welcome to today's episode, Kathy.
Thanks for having me, Anne.
So, what would you like to highlight for our listeners today?
Today, I'm focusing on resources and tools that can help nurses interact effectively with clients presenting in mental health distress, whether it's acute issues or more chronic kind of mental health conditions.
That's a good one. Mental health is such an important aspect of everyone's life. What's important today that you wanted to point out?
We kind of recognize as a practice team that nurses are coming to the North from diverse practice settings, and sometimes they have minimal to no experience assessing clients with mental health concerns. It's an area that's quite prevalent in clients we see in the North. So the goal in developing and compiling tools was to help nurses feel more confident and more supported in their roles so that they can provide optimal assessment and care for mental health clients. I think sometimes nurses feel at a loss to effectively help people who are in mental health distress. And I think it's important to just let everyone know that just talking with clients during an assessment can be a therapy itself if it's done with sensitivity and skill.
That's a really good point, Kathy. Not everyone's had the chance in their career to work in a mental health focused center. So what are the tools or resources that are out there to help guide nurses through a mental health encounter?
So some of the forms include the adult mental health documentation tool, and then there's a child adolescent mental health documentation tool. There's also a mental health follow-up tool that's used when you're reassessing a client who's recently been seen for a new mental health presentations. All of the forms, they've been developed to help ensure that all the essential information is gathered so that when you're speaking with your consulting physician or nurse practitioner, you're providing the right information to get your client to the appropriate resources in a timely manner. Another feature of the forms that nurses have reported finding helpful is within the form headings, there are numerous prompts and suggested phrasing included, and people have found that helpful, especially nurses who may not have had as much experience interacting with clients in mental health distress.
So another advantage to these forms is that we won't have to double chart, correct?
So within the forms, they've developed in the SOAP format. So all of the required charting elements are included within the document. So for those listening, I'd say take some time to look over the forms if they're new to you and practice asking some of the mental health questions out loud, formulating them in a way that feels natural to you. Experience shows that this can help with overall comfort when you actually get to the point where you're speaking with mental health clients.
Those are some excellent tools to use in practice, Kathy.
Yeah, other important forms include suicide risk assessment forms for children, adolescents, and for adults. And just FYI, the adolescent tool has the Ask Suicide Risk Screening questions embedded, and the Ask Suicide Risk Screening questions are from the National Institute of Mental Health. And as I mentioned earlier, all of the forms are available on One Health under Zones, Sioux Lookout Zone, Nursing Forms under the Mental Health section.
Are there any other educational resources for mental health encounters that you would like to recommend to our listeners?
Well, my gosh, Anne, there are so many resources for mental health available. Just a reminder about the mental health modules through St. Elizabeth's. And then more recently, there are two great interactive modules available on the iTacit platform. The first being an introduction to mental health assessment and the ISC tools that I've kind of outlined previously. And the second module reviews the mental status exam, the MSE exam, and that is really an essential part of the objective mental health assessment. You can learn a lot from a good mental status exam. I often turn to CAMH, the Center for Addiction and Mental Health. It has fantastic section for professionals. And then the RNAO has a number of really great clinical practice guidelines, or CPGs, including sort of crisis intervention for adults, assessment and care of adults at risk for suicidal ideation and behavior. And there's also a youth mental health promotion toolkit to support effective planning in schools and to promote good mental health of children and adolescents. So that's one that may be of interest to any community health nurses who may be listening.
Wow, so there's a few resources I've learned for myself today. I'll have to go check them out. So are there any key points you'd like to leave the nurses before we wrap up?
So yeah, and so I just want to remind everyone to screen everyone during your review system. So even if they're not presenting for a mental health concern, so asking about mental health and checking in with people normalizes it and shows that you care and reflects a holistic approach to people's health. And that helps reduce stigma that still persists, unfortunately. I hope that this has been helpful.
You've made some excellent points today, Kathy. Thanks for stopping by and discussing the mental health resources that are available.
You're welcome, Anne. Thanks for having me.
Thank you all for listening to the Practice Support podcast. If you're keen to follow up on any of the information you've heard today, head on over to One Health and iTacit, where you'll find more links and resources. For more practice updates, don't forget to find and follow us on our Instagram, Facebook, and YouTube channel at SLKT.Nursing.Practice.Support. And as always, if you have any questions, please reach out to a nurse practice consultant, an education practice advisor, or your manager. That's all for this episode, folks. See you at our next podcast.